I am interested in treating HHT-associated epistaxis. HHT-associated epistaxis is the first and most common symptom of the disease. The effect it can be found in 95 to 98% of the patients, and it is the first symptom in 80 to 90% of the patients. It's characterized by being very variable. It varies between persons or patients in the same family, although they are carrying the same gene mutation. There is also seasonal and geographical variation. Even diurnal variation have been described. It is characterized by being recurrent, spontaneous, or easily provoked by simple physical activity like sneezing or bending from over, or by running, or even by emotional stress. HHT-associated epistaxis can lead to secondary health problems like anemia and malaise. Although AV malformation of the lung, liver, and the CNS is the most dangerous or life-threatening problem in HHT, it is epistaxis which is the most annoying symptom for the HHT patients. Many studies show that epistaxis alone have a negative impact on the health-related quality of life among HHT patients. In Norway, we did a study to study the quality of life in HHT patients, and we measured the quality of life in 3 levels: overall quality of life, health-related quality of life, and disease-specific quality of life. The results showed that many of the HHT disease variables was significantly associated with reduced or levels of of quality of life. In addition, health-related quality of life among HHT patients was significantly lower than the normal population. What was interesting also that although about 80% of the patients reported a good overall quality of life, when they showed all of them showed a poor health-related quality of life and very poor disease-related quality of life. We describe this discrepancy as a discrepancy between the subjective telling and the objective finding. And we thought that this may be due to the coping strategies. That's how the patient deal with his with his disease. And this can explain this discrepancy. So we studied the coping strategies among HHT patients in Norway and tried to find whether they have a mediating rule in the relation between having the disease and the outcome in the form of psychological distress as anxiety, depression, and the feeling of hopelessness. What we found that 80% of the patients means that the nosebleed affect their daily working life, and about 60% were afraid of developing other complication of the disease. Both the coping strategies and the different coping strategies and the experienced illness variables have a significant relation to the degree of depression, anxiety, and the feeling of hopelessness among HHT patients. But the experienced illness were over the coping strategies in this level, in this aspect.